Hi, doctor. In Chennai, like if you see, many people are talking about Monjaro injection. So, what is your take about it? And can you please tell us who are the eligible people to take that drug?
See, the earlier drugs called Ozempic introduced across the globe, and people have started losing a lot of weight, and they started showing the aging signs faster. And people are afraid about the injections long time, and we also discourage the injections and doing a rapid weight loss using the injection in our last few videos also. But this Monjaro is a little advanced version of the same Ozempic. But here, what you need to understand is how it works. The Monjaro and Ozempic, how it works. Basically, it delays the gastric emptying and intestinal motility. Basically, the food stays there in the intestine for a little longer time than usual. So you don't feel hungry, appetite will goes down because you already feel satisfied. So that's the way this Monjaro works. In that case, who are all ideal for this weight loss? These drugs were introduced initially for only for diabetic people. Now, people wanting to lose weight also going and taking the Monjaro injections. Other than diabetic, whom can be benefited? People more than BMI of 30 or people more than BMI of 27 with comorbidities. These are all the people really benefited by the Monjaro injection. Basically, it is a weight loss injection. Who is benefited? People always can't control the hunger and they always eat more because of the excess hunger. Those people are very ideal for the Monjaro injection.
Doctor, as you said, it will reduce the appetite of the particular patient. So, I always heard like, when you eat less or like, when you don't eat properly, you're prone to, get ulcer. So, is that true? Will this cause to ulcer?
Actually, not because this Monjaro injection, what it does, it delays the gastric emptying. It makes the food stays in the stomach for longer time. So obviously, even if you eat less, that will take care of it. But even eating less doesn't make you are prone for ulcer. That's actually a wrong concept. If you're eating spicy food, very oily food, and you are not taking the food in the proper time, these are all the reason for the ulcer than eating less. That you have to understand. And this Monjaro, as I said, it is not so because it delays the gastric emptying, stomach emptying time, so that you won't get that kind of a problem in Monjaro.
Monjaro injection available in India.
Yes, the Monjaro injection was introduced last week. Monjaro injection was officially launched recently in India, and every clinician can use the Monjaro in India now. And the program is very simple. You start with a very small dose. It's an injection. You need to go to the doctor every week for injections. Till now, it's the preformed syringes are not available. So you need to go to the doctor. We have to mix the syringe and we have to inject on you. It's not a very deep injection. It's a very superficial injection like an insulin. So the 2.5 milligram injection has to be used for 4 weeks continuous. This is called loading phase. After the 2.5 milligram, we'll step over to 5 milligram injection, which you have to continue for some time till you started showing the weight loss. Usually, weight loss is seen after a month. From the month onwards, you can start seeing the weight loss. Sometimes, if needed, we have to increase the dose to 7.5 up to 10. See, my practice is I don't go beyond 10 because people sometimes they want to lose weight faster, so they go for the weight loss injections at a little higher dose, but that is not safe. Always losing weight faster is not safe. It shows a lot of aging signs in your face, and when the fat goes in the face, obviously it looks much older than earlier. So not only face, your breast started sagging, your stomach started sagging. When you look at yourself in the mirror, you don't like your body yourself. So always going slow in the weight loss is a very important thing. Always I stick with 5 to 10 milligram only, not more than that. And going slow is always safer. So this is how the Monjaro helps. Some people ask how long I need to take the Monjaro. So is it a lifelong thing? Usually 6 to 9 months is the dosage because the body has to adapt to the new discipline what you are forming, because when you eat more during the Monjaro, what happens is your stomach start getting bloating. So you don't like it. When you don't like it, obviously the mechanism, like the brain will start recognizing, okay, I should not eat more. So brain get used to this new environment. So it won't happen in an overnight and in a few days time. So it has to go a little longer time. So usually 6 to 9 months. After that, it will be stepped down. Sometimes not every week, maybe 2-3 weeks once. Like we step down the dose according to the patient. So is it ideal for every patient? So I definitely don't advise Monjaro for everybody who wanting to lose weight. Always ideal way to do is controlling your diet, doing regular exercise. It's always a good way to lose weight when you have struggle. I tried everything, nothing is working. I'm so frustrated, and I started getting all the medical problems like a high cholesterol and high, sugar levels are going high. My BP is going high. Those people, when they have a struggle, Monjaro might be useful with a physician guidance. You should not take on your own. Recently, I heard lot of gray market, lot of these kind of injections are available. They're procuring from other countries, and without doctors' knowledge, they're injecting. It's really, really unsafe practice. Better not to do it.
So, what are the side effects of this drug, doctor?
Everybody worried about a newer drug when introduced. Everybody worried. So, lot of side effects are noted because when you're not drinking a lot of water during this process, basically dehydration happens because it's slowed gastric emptying and intestinal motility. Lot of dehydration happens during this phase. So, we are advised at least 3 liters of water per day intake. Otherwise, what happens? You might get a gallstones, you might get a kidney stones, and because of that, the gallstone might dislodge into the pancreas and cause a pancreatitis, and they get a severe pain in the pancreas. So these are all the common complications. Some people they have bloating sensation. The bloating sensation always happens because of your overeating during the Mounjaro injection. So other than that, few other absolute contraindications are there. These people should not take the Mounjaro at all. Patients already underwent a treatment for any kind of a thyroid cancer. They are coming for the weight loss. Definitely, they are not advised to take the Mounjaro injection at all. Okay. Because sometimes it increases the chances of the recurrence, increases the already existing cancer. Patients will go for the spread of the disease more. So these people should not take the injection at all. One other contraindication is people who are pregnant or potentially going to be pregnant. Those people should not have this Mounjaro injection. And third thing is the people with the stones, like gallstones and kidney stones, if already existing stone diseases, better not to take the Mounjaro injection.